Today we will present boxing and brain injury with a simulation of a concussion. What is the big deal about boxing? Well, boxing has always been a sport that is associated with an element of risk. Although there are many types of injuries, the biggest one is a potential head trauma to the brain. Between 1950 and 2007, there were 339 fatalities produced in the Worldwide Boxing Commission, directly to the head trauma and damage to the brain. This given to us by Claus and Henry. According to a Lay study in 2019, the significance of the repeated trauma during boxing is just now being understood. What happens here is when a boxer suffers a direct blow to the head, the brain shakes back and forth inside the skull, causing injuries to both sides of the brain. A study given to us by the Boston University describes an acute brain injury as one that occurs directly during a fight. It is related to the blow itself. A concussion occurs when the brain shakes violently inside of the skull as a result of a direct hit. When this happens, there's an entire system shock, disrupting the regular brain function. During the time frame in which a boxer suffers from these symptoms, such as vomiting, visual disturbances, confusion, nausea, there is a possibility of serious and fatal brain injury in the event of sequential strike to the head. Any and all matches must be concluded.
Here, we can see the sagittal movement of the brain when a concussion occurs. This movement can also take place on the coronal plane, causing subdural hematomas that can increase pressure inside the skull and potentially a fatal brain injury. Our methodology. Our procedure consisted on having the anatomical segments taken in consideration. The specifics of how the internal organic debris, such as particles within the skull, clash against each other when a concussion occurs. Using numerical and biogeometrical data provided by SolidWorks, we will be able to determine the proper effects the head size has upon an acute brain injury. Definition of the bone structure. We were able to follow specifications of a middle-aged bone structure, and we were able to construct a proper material using SolidWorks specification, basing ourselves on Kashan Analysis 2019 study. We took in account mechanical properties of the bone structure, such as Young's modulus, shear modulus, Poisson's ratio, mass density, tensile strength, compressive strength, and yield strength. The definition of a neuronal structure. Utilizing a combination of biomechanical modeling of brain soft tissues for medical application and mechanical characterization of brain tissue in compression and dynamic stress, we analyzed an approximate of the properties of a neural material within SolidWorks.
And here we'll see the mechanical properties of the neural structures that are similar to the bone. So for the creation of a proper model, we use the CT scan based on a slicer. Then we try to use it on SolidWorks, but first we need to use the tool webpage 3D Less. So we could use this tool on SolidWorks later. The modeling of a proper system for study and comprehension of this, we also needed to have the fist and the brain according to the dimensions. How the fitted elements come into play? Well, due to the complex nature of such a study, the reproduction method allows to study more accuracy how the separation between the skull-brain structures provided after the impact. And according to Cornerio and Hoshizaki studies and analysis, we use this finite element analysis to recreate the collision and see the results of the head and skull-brain collision. This finite analysis is one of the most used phenomena reconstruction methodologies for when exploring the effects of human body being submitted. As we work on it, it is expected to begin to fill the missing data for evaluation between kinematics of the head during collision and brain tissue missing.
Methodology. All of these figures were joined in an assembly document. Once we got the full assembly, we were able to specify the material and exterior forces into the simulation. The primary forces being recognized in this simulation being the 2015 newtons produced by the actual jab. The results of the simulation suggest that temporal impacts directly in the coronal plane and impact in this area allows it to result in harmful strain degrees in the brain. It was discovered that maximum principal strain in the gray matter and corpus callosum are significantly correlated with concussion. It was also found that linear kinematics is the main blockers to intracranial pressure response and brain tissue misshaping. Through the deformation analysis within the software, we are able to analyze the results of the complete impact the brain received inside of the skull. It can be seen that the full deformation is mostly present on the sides that do contact with the bone tissue. This essentially means that the bouncing motion of the impact is what produces most of the damage deformation. Utilizing a skull that is about 1.1 times bigger, we repeated the simulation. As we can see, the progression of the impact is far greater in scope when the skull is bigger, meaning that the deformation of the brain has a lesser magnitude. Utilizing a skull that is 0.95 times the original size, we repeat the simulation. As we can see, the deformation of the brain has a much bigger area, giving us a view into the proportional size distribution. Conclusions. Comparing both of the deformation charts, we can observe a definite conclusion. The simulation with a bigger skull size in the analysis show a direct relation with the magnitude of the brain's deformation. A smaller skull size tends toward a more severe brain injury, as a skull with a broader area absorbs more of the impact and prevents it from harming the brain, whereas a small skull does not despite the impact at the same rate, causing a great harm to the brain.